ground that's been dragging you down, and get up in the air. Just pretend that you can fly. You'll never know if you can till you try.
Hi, and welcome to Cannabis Helps Dementia. I'm Chella.
I'm Dave, and right up front we'd like to say that we're not doctors or medical professionals, and nothing you hear in this podcast should be considered medical advice.
Right.
We're not experts, but throughout this podcast series, you'll hear from doctors, nurses, research scientists, administrators, other caregivers, and people living with dementia about how cannabis helps.
Like it did for our family.
That's right.
After my mom was diagnosed with dementia, we were thrust into family caregiving and became fierce advocates for people living with dementia,
Including their access to cannabis medicine.
In this episode, we catch up with Cannabis Clinician and Educator Dr. Sherry Yafai.
Sherry Yafai MD is a cannabis and board-certified emergency medicine physician at Providence St Medical Center since 2009.
In 2017, after adult use cannabis laws had passed in California, Dr. Yafai opened her private cannabis clinic, the ReLeaf Institute, where she sees patients referred by physicians for cannabis education and treatment.
Dr. Yafai is a former co-vice president and current board member of the Society of Cannabis Clinicians, the previous director of research and development at High Sobriety, a member of the UCLA Cannabis Initiative, and speaker for UCSD Center for Medical Cannabis Research. In 2018, she was accepted as an Adjunct Associate Professor at John Wayne Cancer Institute, now St. John's Cancer Institute.
Dr. Yafai works to educate physicians, clinicians, and other healthcare providers on the most up-to-date clinical data and research in the field of cannabis medicine. In your practice at the ReLeaf Institute, do you see a lot of seniors and people living with dementia?
Great question. So when I first started my practice, about 75% were seniors, were patients over 65. My oldest patient is roughly 99 to 100. We have, and a lot of people are like, can you use it when people are that old? Yeah, you can. It's the same idea. We're using this to help them, not to hurt them, right? We're helping move their arthritic pains along so that they can move better and faster, so that they can go out and get that good, healthy exercise in and see the sunlight. So that's when I first started. The majority were seniors. Nowadays, my practice is a bit split. So it's about 50-50. So it's either seniors or it's pediatrics. What we're seeing a lot more of is a lot of neurocognitively atypical children, unfortunately. It's nice that we have an option that we can utilize. For some of this, if you want to mirror this, right, you want to mirror what's going on with the older and the younger. The mirror is aggression, disorders, and cognitive speech, right? So it's all about speech, expressive speech, and receptive language. So those are the two parts that we're seeing, and that's where it's mirroring both in pediatrics and seniors.
Awesome. So could you tell us about a client or two specifically that you're helping who are living with dementia and what they're using and how you came to their dose and things like that?
Great question. We have a lot of seniors using this. There's two in particular I'm thinking of.
Wonderful.
And patient is about 80 something. She lives in an assisted living facility. She moved to Los Angeles from the mid United States area, and a bit of that upheaval, and part of it was because she was starting to go through some of the dementia and more aggressive dementia symptoms and couldn't be alone in her own home anymore. So when she moved to Los Angeles, some of that upheaval created some problems. Her daughter had also recently died. And that created a lot of PTSD for her. And whenever she'd kind of recall it, she would start getting sad and tearful and angry, and she'd become a bit combative. And it was really difficult for her other daughter to watch. And so she was having some insomnia as well and wasn't getting along with caretakers. But these are the common kind of points that we see across the board. And what we did was we started with a CBD dose during the daytime. Now, I'll often start with a hemp CBD product, not because I think hemp or cannabis or marijuana are better or worse. Actually, I do it strictly because hemp is legal in all 50 states. And it is easy to start with in a care facility where it is also legal. It is easy because we don't have to worry about flights. The TSA has actually approved hemp CBD products to be carried on airplanes across all 50 United States. So those aspects of it make it easier. So I think we were speaking earlier about, better versus not as good. And there's a lot of that goes into these things, but legalities and ease of administration are such huge factors for us that you can't avoid that.
Yep.
So we started her with a hemp CBD product during the daytime and added in a THC product at night. And that's where I find some of the edibles to be very helpful because they last a lot longer through the night. We'll start with a nighttime edible. And she started kind of changing her tune a little bit. And what we did was we started slowly adding in some THC during the day as well. So I believe ultimately she's on a 4-to-1 product. So it's a mixture of CBD and THC during the day and a THC product or THC dominant product at night. And what you'll see in the videos is really the best part is oftentimes people think that when they use cannabis, they're going to get, stuck in a rut. They're not going to want to do anything. They're going to lack motivation. There's a medical term for that. It's called apathy. They're going to become, really lackluster. And what we find is actually quite the opposite. And this is really important because this is where dose matters because we can get those effects if that's what we're looking for. And sometimes that is what we're looking for. But in this particular patient, we were not looking for that. We were looking for the best parts of her to come out. She plays the music that brings her joy in the afternoon, and she'll get up and dance and sing with her daughter. And she'll, the best part of her shines through. And that's really what we're looking for.
Yes, it is.
The second patient is one that I mentioned earlier. Also a woman in her late 80s, and she has been battling dementia for about a decade now. She was becoming very aggressive with caregivers, new caregivers almost, every month or so. And it was getting exhausting for her husband to kind of help care for her as well. And what we were seeing was a lot of burnout from the immediate ripple, right? The immediate circle that kind of comes out from this. And it's frustrating and it's hard to manage. And the medications that they were giving her, a lot of benzodiazepine sedatives, were kind of taking her, joie de vivre, her like love for life out. And they were like, well, she just either gets really quiet or she kind of, you can tell when she's about to kind of get feisty and aggressive again. And so what we did with her as well was we started with the CBD during the daytime. And remember, the other part about THC that I do try to avoid sometimes with my older patients is that if they're fall wrists. So I worry about them being a little bit unstable on their feet, which is no big deal. I mean, I think of it like if you have a glass of wine, you would also be unstable on your feet. So we don't want to give our, 80, 90-year-old patients a glass of wine or, a beer, right? That's the equivalent that we're looking at. So you want to just be careful that they adjust to that part of the medicine before you give them something a bit more aggressive. And she actually uses THC mints for breakthrough aggression. And, sometimes we forget that everybody has a bad day. I have a bad day. My kids can tell you that. My husband can tell you I have bad days. You didn't sleep well. You woke up on the wrong side of the bed. You overdid a workout, or for me, sometimes if I overdo gardening and I twist something or hurt something or get something injured, you wake up feeling not so great the next day. But that doesn't mean that we should give you medicine to meet the bad days. We want to give you medicine to meet your good days and then supplement on those days when you're having a bad day. And that's the other nice part about cannabis is the flexibility.
Mm-hmm.
So we don't need to, like benzodiazepines, we don't get as much flexibility oftentimes, the body gets really adjusted to it or dependent on it. So if you don't give it the benzo, then what we see is a little bit of withdrawals happening.
Yeah.
And it makes them more anxious and more crabby and more moody and more
Yes.
fill in the blank. And then people are like, well, I don't know why she was having such a good day and now she's not having such a good day anymore. I'm like, missed her dose that her body is used to.
But also benzos are a risk factor for worsening dementia, aren't they?
Correct. So we're seeing things come out in the scientific data about, ambient hypnosedatives, things that help you sleep at night, things that, I say if it turns your brain off for 8 hours, it may have a chance for turning your brain off more permanently, right? So do we need to worry about that? And that's really, part of all of this. This is where we're starting to see some of these changes happening. And with cannabis, it doesn't turn your brain off ever. It's more like a dimmer switch. It kind of quiets some of the excessive noise.
Yeah.
And helps you. That's why some people use it for ADHD, because they're finding a bit more focus. They're finding some of that, excessive noise drowns out.
Yes.
Same thing for sleep. It's a dimmer switch. It's not an on off.
Mm-hmm. Yeah, absolutely. It's not like Ambien where you'll sleep drive or something crazy.
Right. Exactly. So funny enough, I actually have a couple of patients who sleep eat.
Oh my. Yeah, sleep eating is not good.
Sleep eating is it's not a big problem. It is a problem. And it's something that we definitely want to address, because we see people gain weight and they're just like, I don't even know why or how it's happening, but I come downstairs and my entire fridge is cleared out. I'm like, I don't know what happened.
You remember when you eat a lot when you've used cannabis.
Right. Oh yeah. You'll remember it and it'll be tasty. Right?
You'll love it. You'll talk about it. You'll probably post about it.
You'll enjoy it, right? You'll enjoy it, right?
You'll relish it.
So it's that you're never turning off the brain, right?
Right.
And that's really
or the breathing.
Right.
Yeah.
Or the breathing.
Right.
Right. So we can get situations where people accidentally take too much. One thing we have to be really careful about with seniors is their vision, their arthritis, and their hearing. So it's 3 different aspects of older care that we need to be mindful of. I had one patient who really did not want to smoke. About 90% of my patients do not want to smoke. They have no interest in it.
Right.
No problem. And I don't think that's the best avenue health-wise for everyone. But I have one patient in particular who is very hard of hearing. So I need to I have about 2 patients that I can only text with or email with because they can't hear very well. One patient who's got a trach in, so she can't speak, so we have to text. So this patient can't hear very well, so we have to write things out. His vision, he's legally blind.
Oh no.
And third is he's got terrible arthritis. And so it makes for a really big challenge to give him. I can't give him edibles because he has proven that he can't be trusted. He likes the flavor of the taste, or he'll break off a piece. And that will land him in a very bad place.
Yeah.
Who eats a quarter of a cookie, really?
No.
Right, but he can't even break it off well because of arthritis, and it's not really, and it can be a little bit strong. So you have to be careful with the dose there. I can't use his wild tincture because of his vision and his hands. And so we were left to using a vape pen. And that was pretty much the only thing we could use. And it took a while to convince him that this was a good option for him.
Yes.
Because he can pick it up when he wants it.
Yep.
He can inhale as much as he feels comfortable.
Yep.
And then he can put it down.
Yep.
And he doesn't have to squeeze, pick, poke, fill, roll a joint. None of that. He doesn't have to do any of those things.
Right. And the onset is fast enough where he can self-regulate.
Exactly. So he can self-regulate very quickly and easily. And then the scent or smell is not as as noxious as otherwise. So it's really about getting, honing these different options in for patients so that they can use it the best way possible. And that's one out of, every 500 patients that's in that situation or doesn't have a care provider who can assist in that way.
Right.
So I have a couple patients in nursing homes, assisted living facilities, etc. And essentially it creates this huge barrier for them where the caregiver, not only does the caregiver usually have to get the medication delivered to their own home first and then deliver it to the facility. And then, we have to create a whole set of steps and standards. They can't even, do the, you were mentioning the blister pack because it's easy. So I can't even do like the best medication out there. I have to do kind of subpar medication because it's easier for them to administer.
Right.
So, you have to take it like 10 steps down the line, and it's incredibly frustrating.
How do you get Title 22 compliant labeling for those patients in facilities?
I don't even know. I haven't even gone down that path. So most places have just been either they are yes or no, and they will either accept it with a physician's discussion, recommendation, etc., or they are a no, we won't even go down this route. And then oftentimes we'll also go through the state. So we'll get the MMIC card through the state and go through all those governmental steps so that we can provide as many, levels of protection as possible. But no, I mean, the nice part is that the patients who do well with this, as you all know, that, some people it's not their medicine and a lot of people it is. And for those who do well with it, you're cutting back on extra set of hands for nursing because they need, more help at night. They're sundowning, they're sleeping poorly, they're getting up 5 times at night. And so somebody has to sit at their bedside and they have to have 24-hour care and monitoring. We take all of those extra expenses, exhaustion from caregiving providers and, all those other steps and finances, right? So the finances that go into all of that, we take all of those out. And so you give them this extra benefit that doesn't exist with all other medications. I don't know if you guys remember this. There was an article about a year or two ago. God, everything changes with pandemic timeline, right? So I can't remember when anything was anymore.
The year that wasn't.
Right, the year that wasn't. There was an article about nursing homes misusing Benadryl. They were giving Benadryl without a prescription because they were trying to sedate, agitated.
Sure.
Really?
Dementia patients or just agitated patients because they didn't want to have to deal with them at night, right? So they just
they were using Benadryl off label to keep them subdued.
Exactly, and sedated, right? Yeah. Technically speaking, it's considered a chemical restraint, but you cannot chemically restrain people without their permission, right? And without a doctor's prescription. And there's a lot of reasons why we do chemically restrain people, right? We chemically restrain people who are on PCP. We chemically restrain people who are actively punching, our staff and are being violent. We don't chemically restrain people to sleep at night. Like that's not an okay reason to do that. Especially because Benadryl may exacerbate some aspects of dementia.
Absolutely.
So it's this really, we don't have a lot of other great options like we do in terms of cannabis. And so it's really amazing to be able to have this.
Yeah.
So many. It's a shame it's not being used so much.
Yeah. Caregivers, are caregivers benefiting from CBD or full spectrum cannabis medicine as well?
Great question. I've now learned, after about 5 years of cannabis medicine, to do similarly what we do in the ER with STDs. So in the emergency department, to give you guys a glimpse into what we've learned over, centuries, is that if somebody walks into your ER and says, you diagnose them with chlamydia, syphilis, things that are really problematic and they need care because they will end up with much more severe bad outcomes. You cannot just treat the person in front of you. You have to also treat the hidden person, which is the person they've been having sex with. Be that one person, be that 10 people.
Right.
You need to ask about it, and you need to also offer antibiotics for those individuals.
Mm-hmm.
It's important because guess what happens? They go back to having sex with that person and they get back that infection, and what you give and get is a fluid kind of situation. So they come back again for treatment, and it's kind of a bad cycle. And from a public health perspective, that person will go on to spread it to others.
Yes.
Oftentimes unknowingly, but sometimes knowingly. So we need to treat people beyond just what's right in front of us.
Mm-hmm.
Now, the same is true in cannabis medicine, and particularly because we're treating a lot of really sick patients, and because we're treating a lot of people who need 24-hour caregiving, be they pediatrics or dementia or elderly care. Oftentimes what I'll see is now patients are a little bit more willing to kind of own up to what's going on, and they'll say, hey, before I gave it to my mom, child, etc., I wanted to try it out myself to make sure I wasn't drugging them. Right. And then it really comes from a good-hearted place.
Absolutely.
It happens. And so now we need to be really cognizant of, hey, if you take this, this is what's going to happen for you. And remember that your body is different from your mom, child, spouse, and what I'm dosing this for is particular to them. So you need to be mindful if you take it, you can't drive, you can't be, available to them for their caregiving needs, or you can, and where does that fall on the spectrum? So caregivers are absolutely, oftentimes they are stressed, they are anxious, they are also having insomnia because they have to get up with their, the person they're caregiving for, 50 times over the course of the night. And sometimes they fall back asleep easily, sometimes they don't. When they're having their off days or their, caregiver holidays, sometimes they also need a way to unwind. We often find that caregivers have back strain frequently. They get a lot of muscle strain because they're doing a lot of lifting that's beyond their capacity. Maybe they're not doing it the perfect way, right? The ergonomic way, but they're exacerbating their own physical bodies as well. And so can we be helpful to them? Yes, the simple answer is very much so. The beauty of cannabis is that it really does help also from a physiologic standpoint, from a muscle tissue, from a stress and anxiety perspective, as well as from insomnia, which we've mentioned a number of times now. But the important part is people sometimes think like, oh my God, how's this all hocus pocus? How can it work for this and for that? And, A and for Z, it doesn't make sense. And something I like to remind people is that these medications work only where you have receptors. So you have receptors in your muscle and soft tissue, and you have receptors in your brain, which is why it works on both aspects of your body. Do you know where you don't have a lot of receptors is actually in the part of your brainstem that manages your breathing. And that's why we don't see overdoses result in stopping your breathing.
Right.
Really important because we're not seeing people die from overdoses. People feel miserable. Let's be clear, right? Too much THC is too much THC. Most people will have at least one friend or story where they heard about somebody having a really bad episode with THC, and that's terrible, but it won't kill you.
And it's
Won't kill you.
super.
Yes.
I'm going to say it's super prevalent. There's actually right now, there's a lot of stories about kids going to ERs, overdosing on these edibles that look like candy, and mom has left
Or
it out,
taste good
didn't put
because
away.
they're full of sugar.
And they, there's could be vomiting, there could be even seizures, there could be this. But the one thing that's always the same in every story is the child is home resting. They always end up going home. They never die. They always recover. And it's traumatic, true. Anybody that's eaten too much THC knows that it's very traumatic.
It's
should not happen to a small child.
Or an older person.
Or anybody. Right.
There are ways to not do that.
But it never kills
start low and go slow.
Right.
That's right.
You know?
That's right. And I actually take one step further, Chella. I say start low and stay there. You don't even have to go up. If it's working for you, do not increase it. It would be like, it would be the same thing as saying, like, I take 2 Tylenol for a headache, and the next time I should go up. No, just take 2 Tylenol. Right? Don't go up on the dose. Right? We forget this aspect of things. Like all medicine works the same like that, where if it works for you, that's the dose you stay at. You don't have to continue to increase it.
Well, that's being willing to realize that it's when it's working and when it's not also, because I also heard people, it's like, well, I've been taking it for 6 months and I don't get any, I don't see any benefit. Well, then maybe you need to increase it. Maybe you need to try something else.
Right.
Exactly. And maybe you're, doing you're using the wrong chemical components, or the ratio is off for you. There's so many layers to this.
What about topicals? You haven't really mentioned topicals. There are a lot of receptors in the skin, right?
I love topicals.
Yeah.
If I had to put an emoji heart around anything, it would actually be topicals. They are by far and away my favorite underutilized aspects of cannabis. If I could make today something legal to use in the hospital, it would be cannabis creams. And there's one reason and one reason alone. They are hugely effective when they are effective, and they have almost zero downside. So I've had the experience where I've had older patients, so patients over the age around 70, sometimes 80, will see their skin thins, right?
Yes, absolutely. Always.
Really, right. It's just like we talked about, right? Our skin changes. It's an organ system. It's going to change. And what happens when the skin thins a bit is that if you think about that as a defense system, right? This is our body's defense system from preventing things from getting inside of our bodies. That defense mechanism goes down a little bit. And so what happens, again, this is very rare, but I've seen on the occasion is that people rub a little bit of cannabis cream on and they do get slightly lightheaded. And all that means to me is that they've gotten it into their bloodstream a little bit more quickly or rapidly, and they weren't expecting any effects. And again, that passes within about 10 to 15 minutes. And then so if that was the only downside of all the medications I use in the hospital, no big deal.
Right. That'd be great.
I'd pat people on the back and smile as I walked out the door. But it's incredibly effective for muscle aches and pains, for arthritis. We've got a really great research article on mouse models that shows that a topical CBD can actually resolve, quite a bit of inflammation at joints for arthritis. And this year, we're going to start seeing information coming out of UCLA that's doing research with their rheumatology department. They got a grant for UCSD to do research on rheumatoid arthritis and cannabis. So we're going to see those results coming out. But I think that there's a specific diagnosis when your neck, when you can't look in one direction, or your neck gets stiff and stuck. It's called torticollis. And for torticollis, you can literally rub it right on, lather it on, and if it's going to work for you, it goes away in about 20 minutes.
Wow.
And people come into the ER with severe back spasms. I think everybody probably has a friend who's had a really bad back strain and they can't get out of bed for a day or two. Rub the cream on. And again, if it works for you, about 20 minutes, and you can move around a little bit. Maybe not perfect, but you can move around. And that takes me a boatload of muscle relaxers, opiates, and the like in the ER. After about, can work as quickly as half an hour, but I've had people in the ER for 6 hours trying to get their back spasms to go away. And I can sedate them, very, very sedated, and they still have these back spasms. So imagine if we could use a tool that was topical, give me 60%, I'll take it. That's what do you call it? Unique, whereas some people it won't work on them, but some people it totally works on them and it's going to work right away. Right. I mean, we know this about medicine, right? We know that everyone's not genetically the same, right? People respond to all medications very differently. And in medicine, we think a really good medicine it's really good, it works in about 60 to 75% of patients. That is a very technically good medication.
Yeah.
So for example, Benadryl, you know, we love it, diphenhydramine, you know, it's sold around the world everywhere as an antihistamine, right, for allergies. Now, the majority of people, it will do what?
Sleepy, right.
Exactly, it'll sedate them. There's about 20% of people, it'll make them hyper.
Right.
Backs them up.
Well, they do make meth out of it, don't they?
I mean, they use it in a lot of these other drug products, right? They crush it. And actually, we have a subset of, you know, IV drug abusers who actually like IV Benadryl too. It gets them high.
Wow.
So it's like this other, you know, the other aspect to all medicine, right? All medicine works a little bit differently on each individual. And again, good medicine is medicine that works 60 to 75% of the time. Not 100%. Nothing works 100%.
Interesting. Well, and what is it? That drug they just approved for Alzheimer's? I don't think it's even close to working at all, close to 60 to 70%. And they gave it an approval, and they were saying, well, we need to look at it some more. But go ahead, start using it.
I would love it if they would give cannabis some approval, since that has been tested in the population for millennia, hasn't killed anybody.
Yeah, it's interesting that the FDA said, yeah, let's go for that one. But cannabis, no, we still need to study that a little bit more.
This brand new technology is totally awesome. And it's not going to hurt you forever. It's going to be great. But cannabis, we still need more studies.
Yeah. Right. But remember, one of the big reasons behind that is because cannabis, like we've already talked about, for like, let's go 75%. We're going to be a little conservative here. People are using really for fun, right? And that's the caveat. And the point is, and with almost everything in pregnancy, and I'm not saying that I agree here, I think we get overly conservative with our pregnant patients to the point that we're causing peripartum depression, stress, anxiety. You know, oh my God, did I eat a bagel and lox? Is my baby going to survive this?
Well, they don't test drugs on pregnant women, which is probably the right thing to do. And except they are testing the vaccine on pregnant women. So, you know.
Well, I'll tell you why. It's because we've seen now women coming down with COVID during their pregnancies, and the baby dies, is stillborn, in induced labor, and mom is still on a ventilator. So we're in a situation where it's death versus not death. Whereas with cannabis, it's not so severe or black and white, which again is why, and again, I don't agree or disagree on that front, but it's just, you know, the severity is really very different. And that's really where we need to be.
But it's not different for people living with dementia.
Correct.
People living with dementia have a real need to access cannabis medicine, and they're being ignored. And also, yes, maybe 75% of the population who is using cannabis right now, admittedly, are using it for fun, and they think it's not for medicine at all, but they know they feel better when they're using this product. So maybe, you know,
and I think why is euphoria not a medicinal aspect of
100%. 100%. And it comes from the background of the United States, which is a very, I think, very religious background, whether or not we want to admit it, right? That you are, and in that religious background was you're not allowed to have fun. Fun is not okay, right? And that you know, we even see this in like cultures, right? Japanese culture, it's very, you know, everything is held below the surface, and you have to come back. And that's why we see these valves, these pressure valves of alcoholism and spikes of abuse, right? Because I can't keep it under the surface all the time. And that's how my release valve is, right? And so what you're talking about is, you know, this balance, and it goes back to the peripartum stage, this balance that we're missing in our culture in general. Like, you can have a glass of wine and be pregnant. You didn't hear it from me or recommend it for me. For other countries, they do allow women to drink while they're pregnant. It's again, and it's because of the amounts, right? Degrees of moderation. And that's something that we don't do very well here in the United States. We don't do degrees of help, degrees of illness, degrees of Right.
Overconsume constantly. It's just on every level. Yeah.
Exactly. On every level, we overconsume. You know, the internet, the Netflix is binge watching, binge eating at McDonald's. You know, everything in America could be related back to binging. Right?
Yeah.
And
totally.
consumerism and consuming, because we're a capitalist culture. It's all related to that.
Yeah.
Right. This is like where the conversation is changing, right? Can we, alcohol's not evil, but it's not very good for you, right?
92,000 deaths a year in the United States.
Oh yeah, no, that's alcoholism. That's a very,
deaths related to alcohol, not just alcoholism.
Right. So it's this moderation issue, right? Could you unwind with half a glass of wine once a week? Sure, go for it. I'm not going to tell you that's the bad way of doing something. Could you unwind with a joint once a week? Yes.
But which one is stigmatized and which one is applauded? You know, there's somebody mentioned Stephen Colbert had a drink every night during COVID, proudly sucking down his martinis every night, but everybody freaked out when Conan smoked a joint on his last show.
And that's exactly right. And that's it. And that's the issue at hand is, you know, how is it that in every TV show, in every movie about moms, I'll tell you from like something that, you know, hits home to my heart, every, you know, show about a mom, they unwind with a glass of wine every night. They're like, is it time yet to do away with my kids? Right?
That's right.
The way to unwind from being with your kids or your family or the pressures of life.
Wouldn't CBD be better?
Right, it would. It would.
And it's not intoxicating.
Exactly. And so that's where it becomes the discussion. Like, how can we do this better? Can we do this better? What's better for you as the individual? You know, is it CBD every day, all day, you know, 10 times a day? Balance, right? Balance. So,
well, there is a level of intoxication that's wanted, I think.
Right.
You know,
well, of course, you don't drink wine for the taste. I'm sorry.
Or beer.
That's the whole point. That's the whole point is, can we do this better, right?
Yeah.
Whether it's you need to unwind because we're stressed out. Is it the pandemic and you've got 3 kids at home now who used to be in school all day and you're managing a job and this and that and the other thing? Is it that you're caretaking for a parent who has dementia and is breathing down your neck because all the other activities that we used to do with our parents with dementia are now shut down? We can't go visit them. They can't come visit us. Nobody else can visit or take all of that stress off of our shoulders. Can we do any of those things? And if we can or we can't, that's really part of the discussion, right? Like that's where we want to be able to use CBD in these situations. We want to use THC in these situations. We want to be able to use combination treatment here. And guess what? We even have other minor cannabinoids that we want to use. There's CBDA and THCA and CBG, all of these different aspects. And I tell people, it's like, you know, do you prefer vodka, tequila, beer, wine? I mean, there's like 100 different versions of this, right?
Right.
And then within
shots or dabs, you know, I mean, it's
there's so much variety that comes of it. And that's why, you know, we need to have these real discussions. We need to have these really intimate discussions about what's going to be best for you as the individual, you know?
Well, when I was caregiving for my mom, I got into a very bad habit of drinking way too much wine. At one point, I would go to my mom's nursing home, let's just be real, and I would buy a can of wine at the supermarket across the street and go over and help her with dinner and the 3 other people at her table with dinner while I drank my wine. And then I would go home and I would have more wine with my dinner.
Right, because that was your coping technique.
And 40 pounds later, you know, I was having, you know, terrible sleep and all kinds of other issues. And of course, we now know even more that, I mean, I read a study recently that even 1 glass of wine causes brain damage. And
a day, right? It's not overall, it's a day.
Yeah.
Right.
Yeah.
Like, so again,
I was drinking every day.
multiple glasses, right? Exactly.
Yeah.
So these are those things where, you know, it's, you know, Chella, that was, for example, your situation. Another caregiver might be like, well, I took one of mom's Xanax. I took one of mom's Ativans too. And I was doing that plus wine plus.
Yeah.
And then we add another, right.
No problem.
So we talk about like, oh, can I also use cannabis as a caregiver? Yes, that's better than using mom's Xanax, benzos, fill in the blanks.
Again, those help to increase your likelihood of having dementia yourself.
Yes.
So when I finally kind of had an epiphany about alcohol, I went, oh, yeah, because I kept my diet really tight, but I was still drinking.
Yeah.
And I finally had an epiphany about that. And I did start using CBD regularly. And I would use a ratio product. So it had a little bit of THC in it, but not enough to make me feel intoxicated or lightheaded or at all. Just receiving some of those benefits, maybe pain relief, maybe
calming,
yeah, mood elevation.
Up here, and just bringing you down a notch, right? Without feeling like you're stoned or high or intoxicated.
Yeah.
And that's
something a little extra.
Right. That's I mean, well, who doesn't, right? Who doesn't when you're in that situation?
Well, I think we're going to, Cello's always talk about there being an FDA recommended amount of CBD you need every day. There's quite possibly that might be something on the horizon. I mean, if you look at the way they're trying to legalize it, they're making moves to saying CBD basically should be a dietary supplement. You guys should be looking at it like that way, and there might end up being recommendations. It'll certainly amount for amounts of how much you shouldn't take.
Well, I think in order to get there, the first thing we have to do is recognize that we need to actually test for it, right? We need to test our blood and see what our individual system looks like.
Right. And that mechanism is not.
We know that we've got our own endocannabinoids, and are those levels off the charts? Are they low?
Right.
Do you need this as a supplement because your levels are low? We do this with thyroid, right?
Right. What's the range? What's the normal range?
Right.
And in order for it to be, like, if it's a supplement, then the assumption is that you have it yourself, but you're low or deficient in it. But if we can't measure it or see that deficiency, then how are we just gonna, make this as a blanket statement? So that's another aspect that we, when we talk about the medical side of things, we really need to push forward. And I'm really excited. I think this is going to be the first group that we talk about this, but Pacific Neuroscience Institute. So that is PNI at St. John's in Santa Monica, as well as a very grateful donor, has given us a chunk of money to start doing research with dementia and cannabis. So we're going to start doing that coming up in the next 3 months.
Oh my God, that is amazing. Yeah.
So we're
Let
very
us know
excited
if we can help in any way at all.
Oh my God.
Yeah, we're going to start recruiting. We're still kind of stamping out the plans on how to do this best and how to reach the most numbers of people. Clearly, we cannot, give medicine to people, but what we can do is advise them on how to use what they're using, how that works along with the medications that they are using, and really adjust things so that we get the best results ever. Oh my God, you guys are we tearing up a little bit? I know it's great. And it just goes to show that when people get involved and we have good outcomes, it's the work of the people and the donations of everyone that really take it to the next level. So what we're going to do is we're going to start monitoring outcomes, and hopefully within the year see, how things change. And I'm so thankful to be able to say this is because we have been seeing that change, and we have been seeing these incredibly positive outcomes. I have one incredibly grateful patient who's it's an older gentleman, and his wife has had dementia for a number of years, and they've spent tens of thousands of dollars on procedures and medicine and, ultrasound based procedures, and really, what we think of as alternative type medicine, and nothing has worked. And we got her on a CBD THC combination medication, and she has more good days than bad. She sleeps better. She doesn't get into fights with caregivers. Mm-hmm. She is more cognizant on more days about who's around her. right? She has clearer days, right? Those days where she recognizes people more often than she has in years. And that's incredibly impressive, especially when you think about, the trajectory of dementia is down, right? It doesn't go down and then
there's no
it doesn't it doesn't curve back up. So the fact that we're seeing this, downtrend that's kind of not just stabilized, but maybe even kind of goes up and down a little bit is really phenomenal. So it's really a testament to the medicine. We're seeing research studies coming out of Germany talking about how THC specifically given to dementia-induced mice delay that onset of dementia, and not just delay, but they do better for the longer period of time. And the question becomes like, but THC is not good for the brain. But the brain is not a stagnant organ, right? None of our organs. I mean, if you look at your skin, I would show you my flabby arms, but it's just really embarrassing for me. But your skin changes, right? I mean, that's the easiest, most visible thing that we can tell on everyone, right? Our skin, when your baby's lovely and bouncy and plump, and you get older and you get hair changes and sun changes and you get plasticity changes, right? You get all of these changes that become very visible, and then you get a little bit older and then you see dryness settle, and you see sun damage settle, and you see wrinkles settling, and those are the different changes. So would you say that a cream product that we use on a, let's say, 75-year-old should act the same as a cream product that we use on an infant? No, absolutely not. Nobody would say that, right? Like, you wouldn't use acne medicine on an infant. And maybe THC and CBD are going to be the same thing, right? Maybe this isn't good for a developing brain, neurocognitively normal. Let's put a caveat in there, a neurocognitively normal brain, but maybe at the other end of life, right, where the brain has changed, it's got some damage from alcohol, nicotine, life, trauma, PTSD, emotional stressors, right? Got food, right? Whatever we've done to our bodies at the age of 80 plus, let's say, even maybe a little earlier, it takes a toll on our brains. We know that, right? This isn't like new things I'm talking about. But maybe at that point, this THC CBD combination is going to come in and help be a little bit of the cleanup crew. Right? Where it's like cleaning up some of that mess that we've kind of left behind in our brain, and allowing for those neurons to kind of fire a little bit more normally. So that's really, where we're seeing these different aspects of cannabis use in life. So, whether it's behavioral, so aggressive behavior that we see with a lot of older adults going through dementia and Alzheimer's, whether it's sleep disorders, insomnia, frequent wake-ups, they're not as active during the day, they get up a little bit more frequently at night, and then that's the vicious cycle that continues. And we know, by the way, that sleep is incredibly helpful for prevention of dementia. So that's one thing we know, right? Very clear. So if we can get people to sleep better, then maybe we can help kind of delay a little bit more of that onset. And then there's the other aspect. Could this even be helpful, right? Just for the actual disease state itself. And that's really, I think, where we're going to start looking in with PNI, Pacific Neuroscience Institute, myself, Dr. Sherry Yafai at the ReLeaf Institute. We're going to be looking in and working together. The goal is about, 5 to 10 patients in a clinical arena to do these kind of group discussions and see where we're shining and where things aren't working. So where we can make this work better.
Amazing.
Super exciting.
Amazing. I'm very, very excited about that progress.
Me too.
Of course, I hope to be in greater contact with you as you go through it.
Absolutely.
Very exciting. Well,
Perfect.
Dr. Sherry, thank you so much.
This has been awesome. Great conversation, actually, on a lot of topics. It was
great chatting.
Yeah.
Thank you, guys.
Thank you, Dr. Sherry. Have
Stay
a great
safe.
day.
You too.
Okay, bye.
Thanks for joining us for Cannabis Helps Dementia. Be sure to download, rate, and review us on iTunes or your favorite podcasting network.
And please share this podcast with anyone you know in relationship with dementia.
Do you want to tell your story of how cannabis helps dementia? Leave us a voice message at anchor.fm/Cannabis Helps Dementia, or you can drop us a note or connect with us on the socials.
Check out the Society of Cannabis Clinicians website to find real medical professionals familiar with cannabis medicine in your area or online.
Because you remember, we're not doctors, just family caregivers turned advocates.
And don't forget, download, like, and share what you learned. Cannabis helps dementia.
Why don't you get wise? Get up and get out. Get rid of that frown that's been dragging you down and get up in the air. Just pretend that you can fly. You'll never know if you